All right. So, what are we going to talk about today? Well, we're going to talk about the very, I want to say not problem, but the very life stage that many women, if not all, will go through in their life, which is perimenopause and menopause. And we hope that we can shed some light on the solutions that you can, dive into solving your symptoms and finding ease transitioning through and into this phase. I want to say a couple of words about today's agenda in general. So, we're going to look at Eastern and Western approaches to perimenopause and also how Eastern and Western approaches look at the phase that is perimenopause and menopause. We want you to take away solutions and options to support you in managing this phase. And then, of course, answer all your questions that we couldn't through the presentations. At the end, we also have a couple of goodies for you, so definitely stay to see what we have in store for you. Without further ado, I give the microphone over to Liza, who will tell you a little bit about one of the sponsors of this event, which is Attention Grace.
Hi, everyone. Also, hi to my other Liza. I agree. I never hear my name, so that's so nice. Your last name, I went to Tuck Business School, so your last name is also special to me too. But anyways, so Attention Grace started in 2020 as the first female-founded natural incontinence care line. We make cleaner, more sustainable, higher performing incontinence products for anything from postpartum bladder leaks to more severe gushes and flows once you're older and later in life. But they cause no skin irritation, but still perform up to other brands' standards, if not outperform. So we're on a mission to not just obviously get these products into the hands of women that really do need them, but also to lead with education as to why it's so important to understand what goes on in your body at different phases of life. Incontinence, or bladder leaks, as a nicer way to say it, is still such a taboo topic. But so many women, I think the stat is about 80% of women over the age of 65 experience some sort of bladder leak. So many women experience it. So it shouldn't be something of shame. It shouldn't be something that no one speaks about. And it also isn't something that there is no help for. There's so many ways to help improve symptoms, even in some women remove symptoms. And so we're very excited to partner with Chi Health because they share that similar mindset of leading with education and providing resources so that women can make the best decisions for their wellness journey.
Amazing. Thank you so much, Liza. A little bit about Chi Health. I'm Camilla. I'm the co-founder of Chi Health, and I, like so many women, struggled with a chronic female health condition. For me, it was debilitating period pain after I stopped hormonal birth control. And for years and years and years, I went to doctors really in different countries and never could find a solution or even an answer to what I had until I found a traditional Chinese medicine doctor recommended by a friend. And for the first time, really, all my symptoms were explained to me, the root cause of what was happening in my body, why I was experiencing the pain that I had every month was explained to me. And after 3 months on a customized, high-dosed herbal medicine prescription, I stopped having pain and I stopped having lots of other issues that I would have never thought were related to my period pain. So that was an eye-opening moment for me. And what I really found in the journey was that there was no real easy accessibility towards finding certified, qualified traditional Chinese medicine practitioners. And then in the next step, finding triple tested, clinically effective herbal medicine. And so that's what we're trying to do. We are the first digital health platform that connects you to vetted practitioners online so that you can find answers to the symptoms that you're experiencing, get an explanation about the root cause, and then a high dose yet gentle on your body, customized herbal medicine prescription to hopefully find long-term relief. All right. Moving on to our speakers, Liza, would you please introduce the wonderful speaker that you got us for this event, Dr. Barbara Frank?
Yes, Dr. Barbara Frank is one of Attention Grace's amazing medical advisors. She's an OBGYN practicing at Brigham and Women's Hospital in Brookline, Massachusetts. And she helps us with all the educational content, looking at different products that we are making, and really just serves as an expert for all things, not just bladder leaks and incontinence, but questions that women ask about health in all different capacities. She's done a bunch of amazing content for us on perimenopause and menopause specifically, and has answered a ton of different questions. And so she's going to be able to provide not just an amazing insight on those specific topics, but everything beyond that. I know she's going to get into HRT a bit, and she's really well versed in just all these different practices and methods that can be used to help you through, peri and menopause. And is also a big fan of TCM. So it's a great combo. But I'll let Dr. Frank speak a bit more about herself as well, because I'm sure I'm missing some amazing pieces.
Of course. Please, Dr. Frank, if you'd like to add anything.
Thank you so much, and thank you for that lovely introduction. I'll get into kind of including all these things when I talk at my slides. Thank you.
All right, perfect. I would like to introduce our very own Dr. Mary. She has been with us really from day one. I was connected with her very early on in my journey to understanding how this medicine is practiced in the United States and how we could even bring it online, if at all. So she's seen it all. She's been with us for a very long time, and she's very I would say a very, advisor, the doctor that also sees our patients. And she's a certified acupuncturist and herbalist with a doctorate in acupuncture and Chinese medicine. She has over 28 years of traditional Chinese medicine and integrative medicine experience. She has, of course, her own practice in upstate New York, where she sees patient or has seen patient for over 25 years. And she's also a professor at the Pacific College of Health and Science, Mercer University, and Kaplan University. So if you have any questions about Eastern ways and integrative medicine ways for perimenopause and menopause, she is absolutely the right person to talk to. Okay, so I will give it over to Dr. Frank to start us off. And I hope you enjoy. And please, gentle reminder to ask any questions using the chat function.
Hello, everyone. So one more thing about myself is that I am kind of this East meets West practitioner. So I grew up in a house of Eastern medicine. My mom practiced everything from hypnotherapy to acupuncture, Reiki, some neuro-linguistic programming, and she did a lot of speaking, back in the 80s when all of this holistic complementary medicine kind of took flight. And so when I was applying to medical school, people were asking me, why are you going into Western medicine when you were raised in such an Eastern medicine household? And I would joke that if you had needed a limb repaired, you would want to go to the Western doctor, but there was also, to deal with all those things that come up after that, you might want an Eastern approach too. So there is always a place for both East meets West. And I also am a certified doula, and I use that work as an obstetrician. So I have East meets West in all forms of my practice. So we'll start with what is perimenopause as a definition. The actual definition of it is defined as 10 years before the onset of menopause. So after, I believe it was New York Times had some big movement on this in the past year, and it was all over the news, and people were calling for appointments to discuss perimenopause. And I said, shocker, you've been in perimenopause for years. Welcome to the party. It's nothing to be scared of, and you're living it now. So I have loved that a lot of people have come around to start asking questions about it, but it is something that takes a long time and is different for everyone. So the formal definition is 10 years before menopause. And what are the symptoms? I mean, I joke everything and nothing. So something as small as You're not falling asleep as quickly, to things like what you would normally think of the vasomotor symptoms, like hot flashes, vaginal dryness, change in your bone and muscle composition, change in belly fat, and mood changes, brain fog, and obviously changes in libido as well. And the question is, what's actually happening in your body? So, not to be mean to our ovaries, which are so powerful and wonderful, but over time they get tired. So we're born with all the eggs we'll ever have, and every month we ovulate, and then just over time some of the tissue essentially dies. And when you run out of eggs, that is menopause, when you're no longer ovulating. So you have a decrease in all of your hormones, estrogen, testosterone, and progesterone, which is all through the HPA axis, or the hypothalamus pituitary, and your ovaries. So that's what's decreasing during perimenopause. Next slide. So what is menopause? So menopause is defined as 1 year without menses, or 1 year without a period, and can be very confusing definition for a lot of people, because many people are on hormonal suppression of or some sort of hormonal for contraception. And so you might not always know. So a woman that has an IUD and is amenorrheic or isn't getting a period may not know when the periods have been cessated for 1 year. It might be more based on their symptoms. And then also there are some blood tests you can do, an FSH, or a follicle stimulating hormone. And when that's elevated, that can mean menopause, but there's no one great definition, because you could go 3 months without having a menses in this perimenopausal phase, and then you have a big painful period or a heavy period, and then your labs would be different month to month. So it's not a one size fits all. But I hate to have such a strong definition on what is menopause, because even though, yes, it is no bleeding for 1 year, the menopausal symptoms are what I want people to focus on. So if it's not a problem, it's not a problem. And I say that about everything with people. If it's not bothering you, then it's not a problem. But if you're having a problem with menopausal symptoms, which I'm sure many people know what these are, and we just talked about them, then that's when you want to ask for help and questions. And we talked about the decline in your hormones as well. That is what is happening in your body. Next slide. So HRT, hormone replacement therapy, bioidentical hormones, creams and patches and gels and pills. All of these things are kind of all the buzzwords right now about HRT. And I'd like to give a little bit of history, because it feels like perimenopausal women right now don't know how popular this was, and kind of the history of HRT. And I joke HRT is making a comeback, but it really is. I went from not prescribing it at all and barely learning about it in residency, to now doing my own homework on it, because so many women are asking. So HRT was actually first created in 1942, but it wasn't until the 1990s where hormone replacement therapy became very popular. And that was giving women estrogen and progesterone to kind of mimic or replace the loss that was happening during the change. Then that in the Women's Health Initiative, or Women's Health Study, which was actually done right here in Massachusetts, was an ongoing study from 1991 to 2006. And it kind of shown these side effects, and they ended up stopping the study and making it giving kind of a bad rap to hormone therapy. And basically what was saying was that the Nurses' Health Study said that there was an increased risk of breast cancer and stroke in women taking HRT. But what they forgot to mention when this was the headlines all over the place back in the early 2000s was that these women were much older. So the ages were in the 70s. And the doses were different and of what we give now. And what we know is that when you start hormone replacement therapy in perimenopause and towards menopause, you're having a less increase in brand new estrogen. So these women in the Women's Health Initiative were in their 70s, had been maybe 20 years since they had seen estrogen. Then they gave them hormone replacement, and their bodies reacted to it with an increased risk. So there are risks of increasing breast cancer and of stroke risk. Same of when you take the pill, you have a risk of stroke or VTE, or venous thromboembolism, which is blood clots, which is why when you have a young woman that you start the birth control pill on, you ask them if they have any family history of clotting, because giving exogenous estrogen can increase that risk, albeit low. So to kind of debunk this scariness of HRT, it came out that said, don't use HRT because you're going to get cancer and you're going to get a blood clot. So it kind of went away, and the prescriptions of hormone replacement therapy really decreased. And it wasn't until recently that I feel like people are kind of perked up to hear more about it and want more data and want to learn a little bit more about it. So there are, so the benefit of HRT is that you are trying to not have such a huge decrease in loss of hormones. So it's important to have a really smooth transition. So the definition of a safe way to use hormone replacement therapy is to have the lowest dose for the shortest period of time. So it means checking in annually. It means starting early, having the discussion early, and then deciding, I'm doing really well. Let's go down on a lower dose. How do I feel on this dose? And then, go back up. So it's a constant back and forth and a lot of questions, but being on it overall is very, very safe, and is something that you should talk to your doctors about if you're suffering from side effects from menopause that are bothering you. And next slide. So we talked a little bit about this in the last slide as I was rambling on, but what exactly is HRT and how does it work? And who is it good for and who the benefits the most? All women, it's good for everyone. And so I don't think there's one person that benefits more than others. You'll hear stories. I was just talking to my aunt the other day who turned 70, and we were talking about her menopause. And it's so interesting how she sees it as such a different, she wasn't afraid of it. She lived a very healthy lifestyle. She was very positive into like, oh, well, this means I can't get pregnant anymore. What a great time in my life that was. And so that was how she viewed it. And she actually has never really had any symptoms. Her periods kind of went away, and then that was it. So she didn't have anything. So maybe but if you are really struggling with things that are bothering you in your life, specifically libido, hot flashes that are super debilitating, that make it really hard to be in public, or you're changing your clothes and your sheets every night. Those are things that are debilitating. So I think that that's a huge place you can benefit. And sleep, we know how good sleep is, and rest for the brain. And if hormone shifts are causing you to not sleep, that's a big problem as well. And you can Google side effects of being on HRT and discuss, so I won't go into details, but there are breast changes. If you start estrogen, you might have noticed breast changes, menstrual changes. So even if you're postmenopausal and you're on hormone replacement therapy, if you start having bleeding or spotting, you will need to be looked at, because there are risks of changes in the endometrium or in the lining of the uterus to follow up with. Some people, especially if they take it orally, might have some digestive issues. I typically am a fan of using a patch, but sometimes people do better on the pill. So there are ways around that. Mood changes, sometimes for the better, sometimes for the worse, some bloating, since you are giving back hormones. And as you can think about it, when your hormones are high, either in early pregnancy or right before your period, or premenstrual syndrome, you might get some of these premenstrual syndrome feelings because you're adding back hormones. Some women might get headaches, some weight changes, sometimes some slight weight gain, which can be water weight when you first start. Skin changes. I have had people that, just like when you're, pregnant, you have, you can have melasma, you can have different darkening of the skin. There can be changes with that. And all of those, all of those side effects can be worked with and don't always stay forever. And we talked about how long you use it for. So the shortest amount of time, the lowest dose. I usually will start talking to people about weaning off and down between 55 and 60, depending on how you're doing. However, I just spoke to a woman this morning who's been on HRT since 50, and she's 72 and going strong. And we've weaned down to the lowest dose. And she actually cuts her patches into quarters. And for her, that's what works. And she's, 72, and she wears a quarter of an estrogen patch, and she feels great. So why mess with it? And then how do you go about getting it? So there's two different, ways. If you go to maybe a traditional gynecologist, we will use estradiol, which is the form of estrogen, and typically it is either a pill or a patch, and then progesterone, again, pill or patch, or a progesterone secreting IUD, which I'll digress. If you have an IUD like the Mirena or the Skyla or the Kylena, which have progesterone, people will say, oh, I think I'm through menopause. Should I have it taken out? And you can actually leave the IUD in place through perimenopause and menopause as protecting the lining of the uterus. It might decrease your intermenstrual bleeding, your irregular bleeding, and then it's protecting the uterus. So if you decide to go on estrogen, you can use that as your progesterone. So it doesn't always necessarily need to come out. It can kind of help with, to decrease any spotting or irregular cycles. But there's also these bioidentical hormones or compounded hormones, which there are many practitioners. I don't myself practice this, but what they do is they'll draw your labs every couple of months, and based on where your hormones are, they add back. And then there's these, I've been hearing a lot about these estrogen pellets. There's testosterone creams. There's vaginal progesterone. There's so many other options, as long as you have well vetted and trust the provider you're going to, and you've been okayed by your physician to be able to be on hormones. You don't have any other risk factors. There's many different ways to do this, and you have to play around with it. It's not one size fit all. So I play around with patients because not everybody is exactly the same and might need different formulations. And I think that's next slide. And so simple tools, always going back to the basics. And there are, of course, medications, and I wanted to speak on hormone replacement for this talk, but there are so many other things that help with a healthy lifestyle for aging. Simple things, exercise, healthy lifestyle, time for meditation. I mean, there's so much data on the brain and meditation and decreasing Alzheimer's risk. And, starting now for a healthy body, asking questions in your early 40s, your mid 40s, you don't have to wait. Be prepared and layer appropriately. So some of the most, bothersome things for people is the simple, I get a hot flash and I'm out in public. And the simplest thing of, okay, well, wear layers and bring a small fan is just life-changing to people. They're like, oh, I never thought of that. Or keeping, having special sheets that wick away moisture. So there's all sorts of things you can do to plan ahead for these bothersome times. Create your team of doctors and practitioners. It takes a village. And find a community that supports women and other women to talk about. So at every point in your life cycle, find your village. I tell my pregnant moms, find their village. Find other moms, go to a mommy and me class. I tell perimenopausal, menopausal women, find your village, find people that you can sit around with and sip tea or drink some red wine and discuss your bladder leaks and your dry vagina with, and fix it. So this is not something scary, and there's a lot of options for everyone.
Amazing. Thank you so much, Dr. Frank. I will give the microphone now to Dr. Mary. Dr. Mary, please take it away.
Good day, everyone, and thank you for that informative talk, Dr. Frank. And I'm proud to be part of the village that we're building, the community that we're building for people who are moving through perimenopause and menopause. Um, so menopause, and from a traditional Chinese medicine perspective, is kind of an interesting concept because in the oldest text, menopause didn't really exist in the concepts that we would apply in modern medicine to the idea of menopause. The reality was people, especially females, did not live that long very often to experience menopause because of the challenges of childbirth. And so if you engaged in childbirth, very often you had a shorter lifespan. So if you were lucky enough to meet the milestone of menopause, you were really seen as like an elder of the community, kind of like how maybe in modern times we would turn to someone who is 90 or 100 years old and say, how did you, what's the secret to success here? In some of the older texts, 35 would be probably the modern equivalent of 90, and 42 would probably be the modern equivalent of 100. So that's like insane when we think about, the developments in technologies and sciences that have helped women. But definitely menopause, even in the traditional Chinese text, was a milestone of longevity and something to kind of rejoice in almost that you made it this long. And it's a shift, as we know, in reproductive hormones. And some of the translations in traditional Chinese medicine is that if you were to reach the ages of menopause or perimenopause, you would go through a concept of almost like reverse puberty. And I kind of like that idea of like, it's the idea that we're having a shift in hormones that's preparing us for new beginnings. And in contrast to puberty, instead of getting ready for fertility, hopefully we're having a shift in hormones that, takes away that focus from, menses and the challenges of menstrual health, and allowing us to have a time where we can kind of grow and move towards, personal development and, more inner balance in our lives. So allowing for us to have opportunity. So some of the myths of menopause, as Dr. Frank also highlights, is that menopause is kind of a decline in life, right? But hopefully it's an opportunity for more self-awareness and self-growth. We're not necessarily restricted to looking at this as a crisis. As in some points of American culture, menopause was viewed as like a crisis situation. Oh my gosh, I'm getting old and not going to menstruate anymore. Here, I think menopause is becoming more of an opportunity for us to kind of navigate issues that aren't related to or anchored in just our menstrual health, and moving away from that shift and moving more towards this, um, approach of strengthening our bodies for longevity. In TCM, very often they look at the lifespan of a woman as that is similar to kind of the growth of a tree through the seasons of the year. So puberty would be kind of like spring and like, the beginning of growth and development. And then your menstruating years would kind of be the summer life cycle of the tree where, the leaves are abundant and the ability to produce fruit is hopefully abundant. And then as you wane from those fertile years, you move kind of more towards an autumn. So I think perimenopause would kind of equate to kind of the autumn of the female menstrual life cycle, where you're starting to kind of shed the leaves and the fruits, but you still want to conserve your energetics because as we move towards that more winter aspect in the analogy, we want to conserve our energy to be able to rebloom maybe in a stronger fashion in the following spring, right? And so TCM hopes to achieve that retention of strength and allow for us to have longevity by harmonizing our body and our body patterns, our mind patterns, and our spiritual patterns during this transition. So I especially like how Dr. Frank had said that perimenopause especially is everything and nothing at the same time. And so that's where TCM kind of shows its strength, is that whatever it is that's, notable, whether it's positive or negative for yourself, we can kind of look at what patterns that points to in traditional Chinese medicine and provide you some support along that journey. Next slide, please. So in traditional Chinese medicine, as I mentioned, menopause and perimenopause is seen as kind of a transformative phase. And the entire foundation of traditional Chinese medicine is based upon these concepts of yin and yang. And we have this beautiful little symbol on the side of the page here in black and white. Some people know it as the peace symbol or the hippie symbol or the yin and yang symbol, or just more appropriately, the Tai Chi symbol. And the black portion of the symbol represents yin, which is about things that are cool and nourishing and possibly more feminine in nature in the universe. And the white portion of the symbol is going to reflect things that are more yang, which are more warming or energizing and traditionally masculine in traditional Chinese medicine. And menopause is reflecting kind of the shift between the yin and the yang. And for each person, it's going to be different. It doesn't matter how healthy you eat, how conscious you are of your lifestyle choices. Nobody's ever 100% in balance. We're always like slanted a little bit towards one side or the other. So some of us might slant a little bit more towards the yin side. Some of us might slant a little bit more towards the yang side in our imbalances. And some of those imbalances might reflect as being super warm in nature, as Dr. Frank mentioned, having the need for, cooling bed sheets or noticing little hot flashes while you're out and about during the day. Less commonly, but still a possible pattern, is for people to tend towards a little bit more the cooler side of life. And so you need, the extra sweater and scarf, loving the warm tea, disliking the air conditioner when it's blowing. And so ideally, when we want to help people to find kind of their ultimate balance in relationship to the signs or the symptoms that they're experiencing. And what I especially appreciate about traditional Chinese medicine is that the body patterns go beyond that which are maybe directly related to hormones, or what people would think are directly related to hormones. In the development of traditional Chinese medicine, there weren't microscopes, there weren't centrifuges for blood tests and things like that. So we're not restricted by clinical values. They're great to have, and we can use our Western diagnosis to support our TCM diagnosis. But we can also look beyond that, and anything that's notable for a person, including things like your stress levels and how those might vary from time period to time period, what your activity levels might be, food choices, and how those might change both positively and negatively. Dr. Frank had mentioned reference to sleep patterns. All of that provides us clues in traditional Chinese medicine and helps us to find a pattern that we can help you to rebalance. And so finding our balance really looks at the core energy or core essence of our body that is referred to in traditional Chinese medicine as your Jing. So the analogy that they use for Jing is it's kind of the wick to your candle. It's your essence. It's the stuff that gets you through the tough times. Maybe Western equivalences might be like your energetics or your genetics, excuse me, but it's your foundational energy and kind of like how your body develops. So each of us have different Jing presentations that are kind of always in the background. And then from there, that's how we have all these variances in the presentations of patterns, especially as we move through perimenopause and menopause, because the kidneys are the organs that are most related to kind of our hormonal balance in traditional Chinese medicine. And they're also the organs that are responsible for our Jing balance. And so our attempts in traditional Chinese medicine are to make sure that we help to preserve your Jing so that the candle doesn't burn out, so that you have a longer and healthier lifestyle, but also that the kidneys are supported so that all of your organs function to their maximum capacity. Next slide, please. Eastern versus Western approaches, Dr. Frank gave us a wonderful summary of some of the Western approaches. So as we know, Western medicine tends to target symptoms through things such as hormone replacement therapies and all of its variances. And of course, its strengths are going to be that it's effective for addressing those specific hormonal deficiencies. For TCM's approach, it's more about restoring balance and taking into consideration all of those multiple signs and symptoms that may or may not be directly related to your perimenopause or menopause experience. I was watching another instructor a couple of months ago, and they had said that menopause can have up to 80 different symptoms associated with it. But it's to which degree each of the symptoms tends to present. And so TCM will take that into consideration and work on focusing and supplementing and supporting kind of the root causes for your presentations. So whether it's nourishing depleted yin, calming excess yang, helping to build out build your yin or yang energies, we can work towards those. And so traditional Chinese medicine and herbology associated with it are integrated and not competitive. They're complementary to each other. So we can use our TCM approaches, both our herbal medicine as well as some of our physical approaches like acupuncture or energy building approaches like Qigong, to help to alleviate the side effects of HRT if one were to experience it. It can very easily be used in conjunction with our Western medicine approaches and help to balance out these side effects from the pharmaceuticals. And of course, we always look for any possible drug herb interactions for any of the pharmaceuticals that you might be engaging with. Next slide, please. So TCM solutions for hormonal balance, as I mentioned earlier, will take a look at your patterns and provide a personalized prescription that helps to replenish your yin or calm your yang. The Chi Health platform, we provide personalized prescriptions that look at all of the variances within your personalized pattern, so that we can address that. So even though we work off of a framework of the traditional formulations, we kind of tweak and modify based on, how severe the presentation might be for yourself. And so each of our formulas is customized to help to target your individual signs or symptoms. And then the quality of our products is, these are high dose supplements. They're going to be a higher quality than most products that you would find, on Amazon or over the counter, for lack of a better term. If you're not familiar with traditional Chinese medicines, formulations and herb prescriptions, we see that it's a little bit different from what we see in American or European herbal customizations, in that we have multiple active ingredients in our formula. So it's not just one particular type of herb that's supposed to fix one particular portion of your pattern. It's a whole array of ingredients that help to target a little bit of each of the things that might be problematic for you. And so we're able to customize even by the active ingredients within each of these herbs that are available. In addition to our herbal perspectives, traditional Chinese medicine can integrate in our acupuncture, which will help with things like hot flashes and sleep disturbances and mood swings. We can even engage in self-acupressure at home, a real easy tip to help to balance out our kidney energies and to support them as we're moving through perimenopause and menopause, is a little foot massage at night, especially in the middle of your foot. So we can depress kidney 1, and that helps to anchor us, but it also helps the kidneys to feel literally grounded and supported, so that we can get a better night's sleep. And then that sleep will hopefully be more restorative and help with some of that hormonal balance. So using things like acupuncture and acupressure help to stimulate the body's natural healing mechanisms. And then traditional Chinese medicine also has dietary therapies that can be supportive. Once again, we can look at this from the perspective of foods that help to balance yin and yang. So foods have an energetic temperature to them beyond the physical temperature that they might have, such as like if you take something out of the refrigerator, that would be cold naturally, but it may also have an energetic to it that's cool. And so cooling foods would be things like cucumbers and watermelons. So think about the foods that you might prefer when it's summertime or a little bit warmer out. Those would be foods in traditional Chinese medicine that would help to counterbalance against signs or symptoms like hot flashes and night sweats. Or if you're someone who tends towards the little bit of cooler side of things, then you might prefer things like ginger and cinnamon, which most of us, especially if you're on the East Coast like myself here in the United States, are looking for warmth on a date like today. And so warming foods in that nature would help to balance out our yang. And then lifestyle practices can include Tai Chi or Qigong. If you're not familiar with these are energy producing exercises. Exercise might even be kind of a strong term for it. They're movement activities. Sometimes we might not feel like our bodies support exercise, but they are movements that help us to be feeling more limber, especially our joints tend to experience the impact of estrogen decline as we're getting older or passing through perimenopause and menopause. So they also help to reduce inflammation because they support stress reduction. And so these lifestyle practices can be engaged with local practitioners, or it could be something, as simple as maybe looking at a YouTube video and investigating it for yourself online. And then we also want to support activities and lifestyle choices that are mindful about rest, and helping us to protect our jing, or helping to protect the essence of our candle. And so I think a good rule of thumb and an easy way to remember how to protect our jing is not to engage in activities regularly where you're burning the candle on both ends. That's kind of a term, or a phrase we use in American culture, right? So if you're engaging in activities where you're burning the candle on both ends, you want to kind of find ways to reduce those activities so that you can protect your jing and help to support longevity as you're moving out of this time of menstrual and reproductive health and moving towards perimenopause and menopause. Yes, next slide, please. So our myths being busted, TCM edition, probably the first is that TCM is slow and or ineffective. We'll see that TCM is definitely a proactive approach towards longer and healthier lifestyle choices. We address the root cause of your signs and symptoms for long-term relief. So we're taking into consideration your hormonal changes, but they are not the only clues that we have. TCM has this approach that everything is a clue. It doesn't matter if you're like, it's not that bad, or, I don't think it's, worth mentioning, but every little piece of information can provide your practitioner gives us more insight into what your body patterns are. And so having that information allows for us to personalize that supplement for you and make sure that it's getting to your particular disharmonies or imbalances. The second myth is that you must choose TCM or Western medicine, as Dr. Frank attested to. It is not a one or the other approach. We happily work together in integrated formats. integrative care, especially integrative care that takes into consideration not only your physical presentations, but the impact on your mind and your spirit. What's the impact of your stress levels? What's the impact of your activity levels on your body patterns? Really helps people to have kind of the best of both worlds, especially if you're navigating through any possible side effects with HRT or other pharmaceuticals that you might be engaging with. And then I think the last myth that needs to be busted is that menopause needs fixing. As I mentioned earlier, menopause is not something that we should be fighting against. It's how can we support each other to make the transition as smooth as possible? It's not something that requires correction. It's something that requires, understanding, maybe gaining that understanding from our community and our support groups, and finding the best way to achieve balance through all of the methods that are available to us. And next slide, please. So what can we do today? So hopefully this seminar is the first of many steps in your journey to help you feel more empowered and educated regarding perimenopause and menopause. So what we would like for you to do today from the TCM perspective is start noticing those patterns in your body and your mind. As I mentioned, everything is the clue. We may want to, keep a little journal. You can make it as simple as, adding a specific folder in your notes pages on your phone and make a notation whenever you have a hot flash or a good night's sleep or a less fulfilling night's sleep, and kind of keep note of all of those things and see how serious are these signs and symptoms for you. If you haven't been doing this and you're having, some challenges in your transition through perimenopause or menopause, I would say, you can keep doing what you're doing, but for most people that tends to be tiring because you're not having the support you need, or it can be a little bit exhausting because you feel like you're stuck in a rut. So by kind of, taking note of these patterns and making a list of them, you're beginning to pay attention to all of the little details that can help to work as clues as you work with different practitioners on your journey. And so TCM, by looking at those clues, helps us to honor our body's natural transitions. It's a way for us to invest in ourselves. I think personally, it's a celebration of those of us who have reached perimenopause and menopause, that we made it that far, right? And that our health and longevity longer term is worth the investment of our time and resources in the hopes of achieving balance and not resistance. So working with practitioners such as Dr. Frank and myself, hopefully we can help you to kind of honor your body's natural transition and support you as you invest in your balance and help you to achieve your lifestyle goals.
Thank you so much, Dr. Mary. We will answer questions now. Let's see what we got in the chat. First question is from Liza. If the body organically goes through these stages of life as we get older, then why is it an issue when hormones drop for most women? Shouldn't diet play a huge role in creating and keeping a homeostasis environment?
So I can start with that. Thank you, Liza. So I think of food as medicine. I practice food as medicine. So I hear you, and I'm on that train, because I think that in general, we are all inflamed, and inflammation causes disruption, and it's not our fault because the food that we are provided is causing it too, and we are having a huge crisis, but that is a whole nother talk. But regarding that idea, and I think that Dr. Mary touched on it too, is that we weren't supposed to live this long. So no one saw all of these decreases. So women would die in their 40s and 50s, and they wouldn't have this huge transition. But as you can imagine, the big changes that happen hormonally, I will 100% agree with you that women that go into menopause and perimenopause who are protecting their mind, body, and spirit, they are sleeping well, they are meditating, they are trying to decrease their stress, they're trying their best to eat as clean as they can, they're working on their muscles are good, all of those things 100% make transition better. Just like changing those things, they tell you to exercise when you're having PMS symptoms because those hormones help change things. So of course, all of those things will make the transition easier. I think the reason we're seeing so much is that Americans are sick, and so everything is going to make people a little sicker. So I agree with you. It will be easier if you are going into it in a less inflamed place.
Thank you, Dr. Frank. Next question is, what do you advise for 44-year-old woman that is skipping periods? The doctors asked me to go on low dose of birth control, but I prefer not to. Any advice?
So I'm not to give medical advice as I do not know your history, but I will say that in perimenopause, or in any phase, there's women that have, I don't know how versed people are on PCOS or polycystic ovarian syndrome or anovulatory cycles. So any disruption in your period, if you are not on hormonal anything and it's your natural cycle and you've gone more than 3 months or 90 days without a period, the advising is that you do something to cleanse or to wash out the endometrial lining, because the thoughts are unopposed estrogen, meaning estrogen at the uterus, can cause abnormal uterine lining growth. So if I have women that don't want to be on anything continuously, then if it's been 90 days without a period, they can do a 10-day progesterone withdrawal where you take a pill for 10 days and hopefully have a period to kind of reset. It will not change it might just be perimenopausal bleeding. The question, and then she just responded, she took 10 days. Sorry, I missed the question. What was that? 10 days of progesterone and didn't get a period. Is that what it says?
Asked me to go on low dose of birth control, but I prefer not to.
No, I think she just responded. I took 10 days progesterone, but no period yet. So usually within 10 days of, like, you take 10 days of progesterone and within 10 days you haven't gotten a period, then the question is, why have you not? And that's a workup of what's going on. Is there a blockage, or do you have low estrogen? So are you closer to menopause than we think you are? And things like that. So that needs to be worked up further, but you don't have to be on anything. And for other women in that perimenopausal phase that are having irregular cycles, I'm a huge believer in the IUD and the progesterone secreting IUD. So why not treat things locally? Why are we taking systemic birth control when you can just put it locally? So if you haven't gotten it within 10 days after the progesterone withdrawal, you should go talk to them about why.
Perfect. Thank you. I would say we have time for 2 more questions. Next question is, Dr. Mary, what does an initial evaluation look like in TCM?
That was my question.
It is very thorough. So we start with a intake form similar to what you would experience with your other Western biomedical practitioners. A checklist of, do you experience any of the following? A review of any family histories that might be relevant, such as cancer presentations or high blood pressure. And then with that information, then the practitioner reviews it and then puts together other questions that would provide more detail and give the TCM practitioner insight as to what your particular patterns are. So they say that traditionally the intake is 10 questions, but it's really like the 10,000 questions, because even something as simple as I experience headaches, your TCM practitioner would further investigate as to where on the head do they present? Are they dull and throbbing when you have them, sharp and stabbing, a combination thereof? Are they more intense or less intense in relationship to your menstrual cycle? what things make the headache better, what things make the headache worse. So each of the little checks is just the beginning of our inquiry. And then the TCM practitioner will review it and provide additional follow-up questions. So the average intake and evaluation for your first visit is usually around 45 minutes, even including after including the intake form that you filled out. So it's pretty thorough in nature.
Amazing. Next question is, Dr. Frank, what are pre-existing conditions that do not mix well with HRT?
So if you've ever had any trouble or like blood clotting on the pill, we wouldn't give you any exogenous hormones. If you have a family history or your own history of a blood clotting disorder, or you're prone to clotting, you've had a stroke, something along that nature, it could be dangerous. If you have any hormone positive cancers, so a breast cancer, typically in breast cancer cases, women are being allowed after they've been treated to have vaginal estrogen, which is really great because a lot of women go into menopause so quickly with that. So cancer history are the main ones that I would think of that you wouldn't be able to take HRT.
Perfect. Maybe a very quick question on at the end for both of you, because this is what we see being asked a lot is, do you, throughout the span of your career, see any patterns of people taking hormonal birth control and then having earlier perimenopause, more severe perimenopause or menopause?
I think that I kind of all of a sudden had this thought of it's similar to when you have to be induced in labor versus go into labor on your own. When you're taking the birth control pill, basically what the birth control pill is doing is suppressing the monthly up and down. So every month, the egg of the month is growing. That is the follicular phase, which is the first phase. So you're having slight increase, then you ovulate. It waits for a few days. If you don't get pregnant, all the hormones drop, and that drop causes menstruation. So that's what happens every month, which is why you get premenstrual syndromes, which is why there are what we call melimina, which is the fancy word for the breast tenderness and the bloating, all those premenopausal symptoms. When you do the birth control pill, it's essentially convincing your brain not to have the ups and downs. So you're having exogenous hormones that are making your brain think that you're pregnant, essentially. And so you're just maintaining a very low dose. So you're not having the ups and downs. So as you're going through perimenopause, you could imagine those 10 years that your body is slowly feeling a decline in its hormones, as opposed to when you take the pill and then you stop the pill at 45 or 50. Who knows, your own ovaries, who knows, are they asleep, are they awake? It's such an abrupt change. So I definitely think the pill will make a different change in how you feel. Although some women will transition right from the pill to HRT and never have an upset. And also some women are on the pill because they have reasons for needing suppression: endometriosis, ovarian cysts, which can cause torsion and problems, bad fibroids where they're hemorrhaging, so there are good things for it. But I'm saying in general, if your medical provider doesn't think you need it, there are other options for birth control other than being on the pill continuously.
Dr. Mary, maybe a 30-second answer. Do you see any correlation?
I would agree with Dr. Frank's analysis. I just wanted to add that because there's so many transitions that it can occur if someone has been on hormonal birth control and is now moving towards menopause and is deciding to decrease or stop their hormonal birth control usage, TCM is really strong that we can address whatever those signs and symptoms are in addition to those changes as they kind of occur. And so as you're finding your new normal, your practitioner can definitely be in the trenches with you and provide you direct support as your body figures out what its new normal is, whether it's month to month or week to week.
Wonderful. Thank you so very much to both of our wonderful speaker, Attention Grace, for doing this with us. Everybody who joined, of course. I want to say that we're really grateful that you took the time please give us a follow on Instagram and watch out in your email inbox because we will send a special offer from Attention Grace and from G House to hopefully support you on this transitional phase, this journey. Yeah, we just hope to see you soon. Thank you very much, everybody.
Thank you.
Thanks.
Thank you so much.
Bye.